So problems don't just stop just because of the COVID-19 pandemic. That's the message of Win Family Health. We have Al Laws. He is the CEO, and Laura Mueller. She is the executive liaison. Thank you both so much for being with us.
Thank you for having us.
So I want you to just start out by telling us a little bit about your organization and the services that it provides.
Right. So we provide a comprehensive list of services primarily for behavioral health. And so we provide foster care services. We also provide substance use disorder services, outpatient counseling, and also therapy and psychiatric services. So we have a full range of services that we provide to help people with any type of behavioral health service.
And how has that changed during this pandemic, getting people these services that they obviously very much so need, maybe even more so now that we're all going through this?
Well, I think what we've learned through this pandemic is that it's not whether or not we need mental health support. It's just how much mental health support we need and how long we need it for. So I'm hoping that this has been a great experience for people to see that we all have to deal with our mental health. And I think this pandemic has made us aware of that. And so we see ourselves as really trying to help people and destigmatize mental health. You know, if you go to the doctors or, you know, you go to the dentist, nobody says, well, why are you doing that? Or you don't feel ashamed when you come out of the dentist's office. But somehow when we talk about mental health or behavioral health support, we feel so like something's wrong, but it's not wrong. It's actually a healthy thing for us to pursue, you know, dealing with our mental health. And that's what we're hoping that we get people to see, even as this pandemic. We've actually had to change how we've done services during this pandemic, where we've had to actually begin to do video conferencing and other types of support, remote support, in addition to also doing direct support to support our clients and
to make sure that
families.
you were getting to people when they need it. And
Yes.
Laura, I want to talk to you specifically about another part that your organization helps people with, and that's with foster care. So tell us a little bit more about that.
We have been doing treatment foster care for well over 20 years, and we work with disadvantaged youth throughout Maryland. And oftentimes they are teenagers, and it hasn't stopped because of the pandemic. We are still placing youth in care, and that means that we are in great need of foster parents. So we are always recruiting foster parents who have the heart to serve. We are a faith-based organization, so we often encourage and recruit from the faith community. But there is a great need during this time to keep youth safe and home. So we have a great group of social workers who provide around-the-clock support for our foster youth and foster parents. And we work very closely with the birth family, because foster care is meant to be temporary, and the ultimate goal, when possible, is reunification. And WIN has always placed a great importance on the involvement of birth family in the success of reunification. We use family strengthening. It's a skill-based approach where we teach relationship skills, communication skills, and parenting skills. And oftentimes, I would say probably always, none of us are taught those skills. We aren't taught how to parent. We aren't taught how to have relationships. And we aren't taught how to communicate in a healthy manner. We often just mirror how our parents raised us. And we spend a lot of time with both birth family and foster parents and with our staff in teaching all of those skills.
It's great work that you're doing. It's a lot of work that you're doing. For people who want to get more information, where should they go? Should they reach out to you online or make a phone call?
So they can reach us a myriad of ways. I would certainly encourage them to visit our website. It's www.win, which is WIN, familyhealth.org. Or certainly you can give us a call at 410-578-8003.
All right.
All of the information you need, it can be found online.
Okay, Laura and Al, thank you so much, both of you, for being here. And we'll be right back with more Midday Maryland right after this. Stay tuned.